All right, let's turn our attention to other stories now. Recently, the Director General of the Cross River State Healthcare Development Agency, Dr. Betta Edu, says the present economic situation in the country calls for a review of family planning techniques.
Edu said the hardship faced by a mother of 6 who recently delivered quadruplet in the northern senatorial district of Cross River State has awakened concerns for parents to consider family planning as an option. She also cautioned parents to imbibe family planning technique so as to reduce maternal mortality.
Meanwhile, the National Demographic Health Survey estimates that 40,000 women die from childbearing-related causes every year in Nigeria. And health experts advise that if explored correctly, family planning can reduce maternal mortality. Vivian Irikefe has more on that report.
The Nigerian population is projected to exceed 200 million by 2020. The country's high fertility rate has been questioned by the medical community and critics. Adolescent pregnancy is increasing daily, and Nigeria still ranks unacceptably high in maternal, newborn and child mortality. Public health professionals at this reproductive health forum say family planning remains one of the most effective tools to improve maternal health.
In Lagos State, in the public sector, we have roughly about 2,000 doctors and roughly about 6,000 nurses. If you compare that to the population of Lagos State, which is plus or minus 23 million, you would understand that we don't have enough medical personnel to cater for the entire health needs of the state, as it were. Then if you now break that down into the doctors and nurses who will be taking care of maternal health or the maternal needs of the mothers, you will find out that this is grossly inadequate.
We have a huge population. We also have a huge population of women of childbearing age and children who are actually suffering unnecessarily. It's not that the population cannot be managed. If we had more commitment from our government, I feel that we can also go a step further to, improve maternal and child health services. Family planning, as we know, is a strong pillar, is a very, very strong strategy, is the way to go if we're going to deal with the unnecessary maternal and child deaths.
There are 286 public health facilities in Lagos State that provide family planning services, the highest in the country. But the family planning consumables are not readily available.
As a journalist, when you go around to do your to do your findings, you realize that many people know about family planning, but they are not ready to embrace it. Some people will tell you, I've been on particular pills, it fails me, I no longer trust it.
Like when I went to one of the PHCs in Agege, I was given a list of the family planning consumable to buy, because it's not on ground. Now, Lagos State Ministry of Health, the Commissioner for Health has already said that there should not be payment for family planning consumable.
There are different birth control methods that are safe and effective. A meeting with your healthcare provider will help you figure out the method that is appropriate for you. Vivian Irikefe, TVC News.
All right, you're welcome back. Now let's bring more perspectives to this. Now, family planning allows individuals and couples to anticipate and attain their desired number of children, as well as spacing and timing of their births. It is achieved through the use of contraceptive methods.
Now, family planning enhances efforts to improve family health. However, traditional beliefs, religious barriers and ignorance have weakened family planning interventions. Now, joining us is the Program Officer, Service Delivery for Nigerian Urban Reproductive Health Initiative 2, Lagos, Dr. Duduyemi Adiola. It's good to have you join us right now. Good morning.
Good morning.
Thanks for joining us.
Now, when we talk about family planning, in fact, I remember my mom sometime asking, are you thinking about family planning? Please don't think about it. Because the idea is you're trying to prevent how many children you should have when God is the one who gives children.
Okay.
Give us a basic understanding. What really constitutes family planning?
Thank you very much. Good morning once again. Well, family planning is a voluntary decision that is made upon informed decision, and you have information. You are not forced, you are not coerced into it. Like, for instance, you are a young man or a young woman both just got married, you have, your income, we should have a plan. Every organization has a plan. So we believe that every family should have a plan based on what they think they can afford. For instance, if you are rich enough, you can afford 5, 6 children, fine. But if you feel that your current economic status cannot afford you that, then you are making a decision based on what you have on ground. And we have our health facilities, our healthcare providers that can advise you on the method that best suits you, or that is suitable for you. So it's not family planning is a decision that is made based on your understanding of, okay, your ability or your readiness to have children. For instance, okay, you are married and you are not yet ready to have children, you can delay for a while. But traditionally speaking, most people feel once you get married, 9 months, if you don't have children, then they begin to pray for you, because that becomes a problem. But meanwhile, you may have your own plan. So family planning is just like the word plan. It means that you are planning for a family because you want the best for your family. It's not just having children because, the Bible says be fruitful and multiply. All those
multiply. The word multiply comes up very, very prominently.
But let me ask you, in your work so far, do you see any planning going into families in Nigeria? Is it typical of us really to, when you get married, you really want to consciously make those plans, especially as it affects the number of children you want to have?
Well, I think it's a culture that we are getting to imbibe gradually. Usually, looking at our grandparents, our parents, most people did not plan. But, even the economic situation now tells you to plan. So a lot of things, a lot of factors are making people plan now. So it's a gradual process. I believe over time it will become a culture, and that is the vision of my organization, to make family planning a social norm, where it's not, it's not something you talk about secretly, like, I don't want people to hear that I'm going for family planning service. It becomes a social norm where everybody talks about it. It's no longer a secret.
All right, now let's bring in more perspectives here. Now, there are different methods of birth control, and some of them, just certainly we're going to allow Dr. Adeola to give us some of the practical ones here when we get on. But let's give you just a normal overview of some of these things. One of them is hormonal contraception. She will explain all that to us later on. Now, this includes the use of pills, patches, injections and vaginal rings, and implantable birth control methods like the IUD and implantable rod. She certainly will tell us what the IUD is.
Absolutely. Now, according to data by WHO, a total of 13% of currently married women are using a method of family planning, and of that 13%, 8% are using modern method. According to WHO, urban women are more than twice as likely as rural women to use a method of contraception in the ratio of 20% to 9%.
Now, 1/3 of married women in Southwest use a method of contraception, compared with just 4% of women in the Northeast and 5% of women in the Northwest. Now, the National Population Commission of Nigeria, established in 1988, has the statutory powers to collect, analyze and disseminate population demographic data in the country. Now, the issue of population is still features very prominently here, but we'll talk about the issue of population as we get along, certainly.
Yes, indeed. Now, the Commission has a chairman and 37 members representing each state of the Federation and the Federal Capital Territory. Now, the population of Nigeria represents 2.35% of the world's total population. Presently, the estimated population of the country is over 178.5 million and still counting. I wonder how many children have been born already since we started this show. Although United Nations projections have placed the population as high as 186 million. We could go on and on and on, but let me bring you in here. Well, when we talk about family planning, exactly, we just talked about some types of, family planning. But I want you to speak to the idea of family planning and abortion, because when you hear family planning, what comes to mind readily is abortion. Remember the Roe v. Wade, in America, that still source of debate even till date. How do you place this side by side?
Well, family planning is not abortion.
Okay.
It's prevention of pregnancy. So you are preventing the pregnancy that will make you to want to have an abortion.
In the first place?
Yes.
Okay. Okay.
All right. Now, you have some implements here. Can you make us understand the use of all of this, and then when it comes to the methods of family planning that can be employed?
Okay, let me just try to classify the methods of family planning.
Okay.
Family planning methods are numerous and diverse, and different methods suit different individuals, like I said. And one, we have abstinence. It's a method.
Oh, I see.
Yes, it's a method, because if there is...
I'm tempted to ask what would be the best form of family planning.
Well, abstinence is a method.
Especially for a couple, and in countries like Nigeria, with recession and all of that, some people actually say, look, procreation or copulating has become a source of comfort, for people.
Yeah, of course. But even at that, when it comes to abstinence, for the men who are very sexually active, they're going to say no. It's a no option.
I was just coming to say the method.
Yeah.
So it's just one,
Please,
which
go ahead.
is not really applicable to most people, because anybody that is sexually active definitely cannot practice abstinence. So aside abstinence, we have the natural methods, which is okay. Under that, we have the lactational amenorrhea method, which is the method that a breastfeeding mother uses if she's breastfeeding exclusively, meaning that it's not like she's bottle feeding, or she's she goes out in the morning, she comes back. So it's a continuous thing. She's breastfeeding at regular intervals, so that keeps her from menstruating, and so therefore she doesn't get pregnant. So we also have the cycle beads, which is we generally teach the clients how to use them. We tell them, okay, if you have, I'm sorry I don't have that here, if you have the cycle beads, it helps you to know your safe period and your unsafe period, and you're able to calculate during the time when you are unsafe. Then you can make use of other methods like the condoms and the rest. So we also have the Billings method, which is you check there is a cervical mucus that we tell clients to check during a particular time. It's thick, at a particular time it's not thick, so we are able to make decisions based on that. So that's the natural methods, which are really you really need to take out your time to be able to make use of that and get the best result from them. So we also have the barrier methods. Okay. On barrier methods, we have the chemical barriers and we have the physical barriers. The chemical barriers are use of spermicides, which kills the sperms and prevents them from fertilizing the ovum.
So it's the men that use that? Or?
Yes.
Okay.
Then we have the physical barrier methods. We have the female condom and we have the male condom. The female condom is a demonstration that shows how the woman wears the female condom. She wears it into it can be before the process of having the sex, or she can even wear it maybe when they're about to start. Okay, so this is just like usually the way the female anatomy is. So she wears the condom, she stoops down to wear the condom, and is inserted inside, as you can see. So there's no movement of the sperm into
beyond
to be able to fertilize the eggs. Then we have the male condom too. This is a sample of the male condom. I don't know if you want me to go ahead.
Go ahead,
no, go ahead.
Because that's it's a challenging.
Okay, so usually the male condom is worn after an erection, and okay, so that's the male condom. That's the physical barrier method I was trying to talk about. Then we also have the hormonal methods. Under the hormonal methods, we have the injectables. The injectables are the injections. We have the Nouristerat, we have the Depo-Provera. One is 2 monthly, that's the Nouristerat. The Depo-Provera is 3 monthly. So the client goes to the facility to take the injections, and they give them appointments.
In this case, the woman is the one who actually takes the injection.
Yes, the woman is the one who takes the injection.
The man does not take any injections. Okay. But there are some instances where, even when the woman is ready, to protect herself from multiple births or too many children and all of that, the men don't seem to buy into it. How do you convince a man, for example, that look, there is a need for you to buy into, or to support this process of family planning?
Okay, well, that's what we do as an organization. We do a lot of advocacy, we do a lot of demand generation, like we are doing now, a lot of radio programs, television programs, to educate the men that they need to be involved. Because being involved makes the woman comfortable, makes the woman being able, she's able to go with a free mind, because a lot of issues has occurred as a result of a woman going alone for family planning and coming back, the man knowing about it, causing a lot of issues. So we are trying to educate our men to let them know that, well, men who love their wives, they want their wives to live to take care of their children. The fact that a woman has a child every year has implications on her health, and she needs to take care of herself. She needs more time to take care of the children. She needs more time to bond with the children. She needs more time even for the man. She needs more time to go out to work by herself, because a woman that is getting pregnant every year, I doubt if there's anything serious that she can do, you understand? And you know, it tells on her head, she wears quickly, because it's not really an easy task, you know. I'm sure you know what I'm talking about. So, you know, we need to let the men know the advantages, not just to the woman, to the man himself. You know, the woman has more time for him. To the children, she has more time to take care of the children. She has more time to bond. Economically, she can contribute to the family, because she can also go out to make an income for herself. And you know, we are talking about maternal mortality, 576,000 per 100,000 live births, meaning that out of 100,000 women, 576 women are likely to die. That is our maternal mortality ratio in Nigeria. And you can imagine that is very high. Like you just said, a number of women have died just in how many minutes that we've been here now. So we need to talk about all those things to the men. Let them see reasons why this family planning is important to the nation, to the economy. You know, the less we have, as in if you're able to take care of the little, if I know that I can only take care of 3 children, I have that number of 3 children, I give them the best education, the best quality of education. They're able to become even greater people to influence the nation. You know, it was when we can't cater for the number of children that we have, that's when they go out. You know, we have a lot of juvenile delinquency.
What about men,
you know,
men who don't like the use of the condom that you just, you know,
there are many
talked about? What are the other alternatives for men to use?
For the men.
Well, for the men, a lot of for the men, you know,
you're looking at me. Are you referring to me precisely?
No, you're a man.
That look is suspect. But anyway, tell us about that. The exceptions to, because under the barrier, the condom is one of those, and we have heard certainly many people feel, in fact, even from the ladies too, we've heard some people say, I don't like the concept of condom. It's not as sensitive, it's not as natural, it's not as pleasurable as it's supposed to be.
Well, that's why we have several other methods, but it's just that for now most of our methods are female. You know, they are tending towards the female. But there are other technologies that are coming up. You know, we have recent technologies. There are a lot of research going on to ensuring that even men have other options. Well, the other option apart from condoms now for men is the vasectomy, which is the permanent method. And I know because we are Africans, a lot of men have bias, but people are actually getting to accept it more. If you know you've completed your number of children, your family, you already have the number of children you want to have, then you can go for it. It doesn't affect your being able to perform as a man. It doesn't have any negative effect on that.
What's the process of that, vasectomy?
It's a minor surgery, in which there's a ligation of the vas deferens, the tube that carries the sperm in to the spermatic duct. So there's a ligation of it to prevent the movement of sperm in. So it doesn't prevent the man from being able to perform naturally or normally. It just prevents the movement of the sperm. So when the intercourse occurs, there's no sperm movement. So it's a simple surgical procedure.
All right. Now, I know there are injections you mentioned earlier on. There are pills of different kinds. What are the side effects of the use of some of these?
Yeah, we have side effects. We don't shy away from them because usually when a client comes in, we want to tell them all the side effects. And you know, this is something we have. It's called the MEC wheel. It's used by providers. It's designed by WHO. It's just a simple tool that helps you to know, okay, this is good for this particular client, this is good for this particular client. So, you know, every of this pill has their side effects, and you know, being able to use this, you are able to, say, for this particular woman, somebody that comes in, she regularly has headache or she's on a particular medication, we're able to know, this method suits you, this method does not suit you, because you are likely to have less side effects than using this other method. So usually for the pills, some have mild headaches, they have nausea, but the thing is, most of these things wear out after a while. But if you use a method and we see that, it's not suitable for you, or you've used it and you have side effects, then there's an option of changing it to another method.
It's okay. Well, we'll come back to dwell on this, because when it comes to, you know, we're discussing this in the recession, in the recession situation. Yes. Now, we're going to put in the economic perspective to things, especially Nigeria, where we find ourselves now, and the average Nigerian have love for children.
You know, Mike, there's a proverb, or there's a saying actually in Yoruba that says "Omobere,
okay.
Oshibere."
All right, that's in Yoruba.
Yes.
What does it mean?
Maybe she can translate.
Okay, means plenty of children means poverty, as in plenty of, you know, plenty of responsibilities can mean that you will have, you know, more than you can be able to cater
can handle.
You know, can lead you to I don't know if I'm able to do
okay, now there he goes.
All right, let's bring in Foladele in here to give us perspective to this. Fola, good morning.
I saw you dancing.
I was singing a song. Omobere, Ushibere.
Oh my!
Oh, good morning. Good morning.
Good morning.
Good morning, Adiola.
Good morning.
We're getting educated, certainly.
That's why I just got to know Omobere Ushibere now.
All right, so be fruitful and multiply, or be wise and plan.
Yeah.
Let's see what some Nigerians are saying about this. And I tell you, they're saying a lot.
All right.
Okay, the Diva 11 says, the sooner African countries, particularly Nigeria, start effective planning and population control campaigns, the better we'll all be. At I Am Mike Lee says, broke people are the only ones getting married these days and starting a family. Family planning is garbage in Nigeria. Wow. At Oloye says, the rate of childbirth in Nigeria isn't proportional to infrastructure and social amenities available, major hindrance to development. And he continues, I think Nigeria is in a perfect time for birth control laws. Forget that it's God that raises children mentality and make plans for babies. Babsy says, look everywhere. Our universities oversaturated, cities crowded. Same for labor market, hospitals, all. These beg for attention. Catherine Bassi says, Nigerian problems are very far from solutions until there's birth control in our dear nation, Nigeria. Sugar Belly says, so we're just going to continue asking for money to feed starving Borno IDP babies, but not talk about donating condoms and birth control? And the last one here from Ambivalently Nigerian. Abortion should be legal in Nigeria. Birth control should be readily available in Nigeria. Sex education shouldn't be abstinence only in Nigeria. Wow.
Very interesting.
I think that last one there takes it to another level.
To another level, and some might not agree.
Exactly. But I think those are the arguments sometimes the churches and the mosques or the religious bodies put forth. Because when it comes to the issue of premarital activity, it is total abstinence. But we know that that bracket is very active sexually. So how do we... Anyway.
Well, I did also want to ask, which do you think is the bigger problem? Is it ignorance? Is it that people aren't enlightened? Is it that people don't know that you can actually control the amount of children you're having? Or is it just that people just don't want to do it because of some of the things Mike and Ngozi mentioned earlier about, you know, religion and, oh, children are from God, I don't want to tamper with what God is doing in my life. Which do you think is the bigger problem?
I think both are big problems because ignorance is also there. People don't know that other options are available to them. They just hear of the myths and the misconceptions and, you know, they just go with it like that and they don't bother to check. You know, and also the other one you talked about too is also a big problem too. So we have to look at the two of them. They are both big problems. People are ignorant and also people don't know the methods available to them. So they are all big issues that we can't leave one for the other. We have to resolve both to be able to get, you know, to the end of this issue.
Okay. And somebody mentioned, somebody mentioned, you know, legalizing
abortion.
Not even just legalizing abortion, but actually making laws to control the number of children that people can have. You know, of course, the China one is, you know, is well known to everybody.
We had that in Nigeria sometime
some
during
years back under the IBB,
where there were suggestions for 4 children to a woman, but Nigerians kicked against it. But China is back now to 2 children.
More children.
Do you think that will work here?
Well, I don't think that will take a long while to work in Nigeria because, you know, we are not even, you know, everybody, we don't have everybody under our control. We still have the people in the rural area. Yes. We have just few of us here. So that will take a long while to be able to get. And
I think even our belief systems are still very strong.
And the African system, I'm sure even it will be a big issue to get to that.
Thank you very much.
Thank you very much.
Many children and insurance for old age.
Those are children that are well trained and they can give you something at old age. Not more problems or
guarantees, you know, even in the first place. Now some say at a time of recession like this, you cannot overemphasize the need to control the number of children that you have. I wanted to speak to the impact on not just your person as an individual, you know, on your economy, but generally.
Okay. Well, family planning generally, it's not just for recession, I would say. Although people are, you know, we are saying that, okay, even now, nobody needs to tell you to plan your family because even the little funds you have are not enough to cater for the children you have. So, but we should not see it as a recession because definitely we are going to get out of recession. Does that mean that when we get out of recession, we get back to having the just children anyhow? So it has to become, you know, like I said, WHO defines family planning as a way of thinking and living, you know, that is based upon, you know, voluntary decisions to ensure that, okay, you have the number of children you can cater for, you want the economy to develop, you want the country to develop, you also want to develop as a person, you want to do other things rather than just procreating and having children. So it shouldn't just be something that we are getting at or we are thinking it's important because we're in recession. It should be something that becomes a norm, like I said initially, a social norm, something we do, you know.
In the report that Vivian Enriquefe, gave us, some of the respondents there talked about the availability or non-availability of family planning consumables or centers where, you know, it's just not accessible to many people. Yes. So how do we, I mean, when we talk about family planning, without this family planning centers and all of that, how can we really achieve, you know, this ideal?
I think Lagos State at least has one of the highest number of, you know, primary health care centers, and most of the primary health care centers have providers that are trained in giving family planning. And luckily for us, family planning commodities, all these are free. You're not supposed to pay for them. But the only issue we have, which you spoke about, is the consumables. And a lot of advocacy is going on to ensure that, okay, this is put into the budget. Because, you know, when you come in and they say, okay, family planning is free, and you come in and say you can get this free, and they now say, okay, go and buy cotton wool, go and buy plaster, buy methylated spirit. By the time you buy all those things and, you know, you're already running to 1,000 or more, you know, that discourages it. And that's one of the issues we have. Some people have to turn back because of that, because some people can't even put down 200 naira to access the care. So we need to still continue to do a lot of advocacy to our government, the Commissioner for Health, the Ministry of Health, to ensure that these consumables are readily available in our facilities, that a woman, even if she doesn't have money, can access these you know, services.
All right, now the one question I'd like to ask you is, we know also from the issue of beliefs and our cultures, a lot of families, apart from the Enlightenment now, prefer a certain sex, males to females. But in the modern day now, families would like to have a balance of a boy and a girl, you know, boy and a girl. But through family planning, can you determine the gender of children?
No, you can't.
Are you saying in Nigeria? Because I mean, I've heard of situations where you can actually determine
pick.
Yes.
No.
Scientifically, you know, science is now making that possible.
That is not readily available in our country, Nigeria. So we need to go with what we know. People come with a lot of beliefs. Okay, if you do this, you have this. If you do this, okay, what if it doesn't happen? Does that mean you want to opt for an abortion? That means, okay, if you are genetically able to determine the sex of this child, maybe after pregnancy, that means, okay, if it is not the sex that you want, then that means you want to abort the child.
Well, we've actually seen families that have had about, I know a family that has 6 girls because they were looking for a boy.
For a boy, yes.
And we've had family, I've also known a family that has about 7 boys because they were looking for a girl. So we still have issues like that.
Those are traditional issues that we really need to deal with, because, you know, the sex of a child does not determine the success of the child. So we need to begin to educate ourselves to get to that level in which we know that, okay, it's not me having a male children or a male child or a female child that determines the future of the child. It is the kind of training I give to the child. It is the kind of upbringing I give to the child. It is the values that I imbibe in that child that determines what becomes of the child. So you can even have 10 males and it's only one of the females that you have that will be successful at the end of the day. So what do you get from that? So it's not just about the sex, it's about what you put into the child and how much you're able to invest in the child that brings the best out of the child.
Absolutely. I mean, you're very spot on there. I was going to ask you a question that just escaped me now. But really,
while you jig your brain to remember, while you jig your brain to remember that. Now, the issue of population, I still want to go back to it.
Okay.
One of the things Nigerians brag about is the market. The market is the people. The population is one thing that makes Nigeria the big brother. It's one thing that makes Nigeria the big market, the giant and all of that. So if we have population as a strong bargaining chip when it comes to any international related issues, when we say that Nigeria is the most populous black nation in the world, all these are bragging rights. Now, it falls back down to the issue of the number of children everyone has been having. Now, if we have that at our kitty, how does that become a disadvantage when in the presence of, in the eye of family planning that we're talking about?
Well, we can't just focus on the population alone. We want to focus on the quality of the population we have. Okay, so if we keep having children and we don't have plans for the children, then what becomes of that number of population? So it still boils to the fact that family planning is still very important. Having the number of children that you can readily cater for. If you can afford 10, fine. But if you know you cannot afford it, why not have the number of children that you'll be able to cater for? So saying that we have a large population and, you know, we don't have, what is the quality of the population that we have? We should talk about that too.
Indeed, and of course, talking about affordability of a large family or not, it's not just money you need to bring up children.
Exactly.
The emotional presence, time, and all of that that is required. You talked about some methods of family planning. That's the question I wanted to ask earlier. Okay. Talk to us about some of the risks involved, because one has heard about situations about coil, for example, that women use. The ones that cause obesity, they just make a woman go completely out of shape and cause another problem.
Thank you very much for that question.
Talk to us about all of that and which would be the safest, that is easy to adopt.
Okay, like I said, I can't say this method is safe for you until I've sat down with you, asked you questions, counseled you, know about your medical history. So there's no one size fits all when it comes to family planning. It's based on your health status, the convenience. For instance, some people cannot remember to take pills every day. And, so it gets back to not being able to avoid the pregnancy. Maybe because the person is busy, will forget and all the rest. So there is a method that best suits an individual. And even if you have taken up a method, you can still change it if you think, okay, after a while, this method does not suit me. So like you were saying on the issue of weight gain and all the rest, most of the time people gain weight because, they have this rest of mind, nothing can happen. And, they just consciously, forget about the fact that they also need to eat healthy and eat well, exercise. All those things contribute to weight gain, aside from the fact that, we are talking about family planning being the cause of weight gain. Usually, it's the habits and what people do that make even the weights to become more than, the usual. Like, for instance, if, like I said, using this mercury, it talks about your weight too. If you have obesity, there are some methods we won't allow you to take those methods because we know that you're already prone to it, you understand? So those are things that are considered. So it's not necessarily that you shouldn't take a method that will allow you gain excessive weight. And even when you have taken family planning, it doesn't mean that you relax and forget about your exercises and everything. So those are the things people need to consider. So even, I can't just sit here now in 2 minutes, I tell you, okay, this method is good for you. I will first of all explain to you all the different methods, tell you the side effects, then ask you questions, look at your family history, look at your health history. So having said all that, then I'll now tell you, okay, these methods are good for you, madam. Then you now pick, okay, based on what you have said about this, I'll pick this method. So I don't impose a method on you saying you have to use this particular method. Okay. So
now let's talk about Planned Parenthood before we wrap the show. I know there's Planned Parenthood Federation of Nigeria. Do you do any work with them, to help families actually control the,
Okay, well, our organization is Nigerian Urban Reproductive Health Initiative, and we ourselves, it's a family planning project in Lagos State. 95-year family planning project that's helping the state, in terms of training staff. So I can talk about what we do as an organization, not necessarily what PPFN does, but as an organization, we train staff. We provide equipment and instruments. We renovate facilities, family planning clinics, to ensure that when a woman comes in, she's comfortable. Because that's another thing. A woman comes into a clinic and, you know, she feels like, wow, what's this? She turns back right from the door, from the gate. So that's what Nori does. We ensure that, okay, we renovate these facilities to ensure that it's standard for a woman to come in and get all the services that she wants to get. Also, we do a lot of demand generation in terms of, you know, we do publicities, we carry out outreaches in which we do free of charge. All the consumables are provided free of charge during our outreaches so that the woman does not have to pay anything to get the services done. We do a lot of advocacy to the government. We talk to them. Discussions are ongoing to ensure that, okay, we have consumables in our budget such that women come in and they are able to, you know, get what they want.
Wow. All right, Dr. Duduyemi Adeola, thank you for coming on the program.
Thank you very
and thanks
so
for the
much.
enlightenment as well.
Thank you.
All right.
Thank you, sir.
Now, if I'm going home with anything today, it is the issue of Omobere,
Oshibere,
Omobere,
Oshibere,
Omobere,
Oshibere.
All right, this is where we come to the end of today's edition of the program. Thank you very much for spending your morning with us. We've talked about two basic things today.
Yes.
The GMO controversy and Nigerians are getting enlightened. A vivid picture was painted this morning for all of us to understand what it is, so that if you are going out there, you should be able to identify, you should be able to know, okay, if I'm going into this, these are the implications if I have to, and the choice is left on your table.
Absolutely. The onus is on you when you go out there to that big supermarket, or even the small one. You want to check the labels, or you want to find out, is this GMO or not? What are the implications?
Exactly.
You must get yourself educated.
Yeah.
That's the bottom line.
And from the theme of Omobere, Oshibere, this morning that I've learned, we have to actually do deliberate effort to plan our families as we get along. People are getting married every day. People are having children every day. People are having plans and getting involved with each other every day.
Like I said, you know, with the recession, nobody needs to tell you how many children to have. All right.
All right, have a great day ahead. I am Mike Okwache.
And I'm Ngozi Alemu, wishing you a beautiful weekend.